Hello, this is Mark Bellew with Bellew & Associates. It's 2015, and we're in North Carolina, so everything we're going to talk about today is going to be based on this year and being in North Carolina. We're going to talk about Medicare supplements, traditional Medicare supplements, and Medicare Part A and B. This is going to be an overview, okay? So I hope this helps. Okay, our first discussion is going to be on Medicare Part A, Medicare Part A. Medicare Part A, for most of us, if you've worked and you've paid into the system over a period of time and you've earned enough credits with Medicare, there's not going to be a billable expense for you for Medicare, but it's not free because you've paid for it. For the most part, as of 2015, which is the date of this message, the deductible, the Medicare Part A deductible, is $1,260. And then you're going to owe that, and then after that there's going to be co-insurance. Co means two, which means there are going to be two payors. You're going to be one of them, and Medicare Part A is going to be one of them. Medicare is going to reduce the overall billed costs to their level of costing. You don't owe the difference. The medical provider needs to write that off. So it's against the law for them to bill you for that. We call that balance billing. That won't happen with Medicare. Your deductible and co-insurance is going to be applied to their Medicare discounted allowable charges. But once that happens, you're going to owe 20% of those charges after the deductible, and there's no cap. Like in private insurance, there's not going to be an out-of-pocket limit. So your 20% conceivably could go with no cap. Medicare will pay 80%, and that's the way inpatient charges will be covered. Okay, now we're going to talk about Medicare Part B. Medicare Part B. For the most part, Medicare Part B is going to be outpatient hospital and going to your doctor, going to see your physician, away from the hospital, just going down to the corner to the doctor's offices, okay? Now, that's going to have a deductible. It's going to have its own deductible. It's not as much as the inpatient Part A. As of 2015, the deductible for Part B is $147. How they came up with that number, I don't know, but it's $147. So you're guessing it, your Medicare Part F will pick that up as well. And similar to the Part A, after the deductible, there's co-insurance. Co meaning two, you pay some, the government pays some. You owe the 20% with no cap, the government will pay its 80%. Okay, so similarly to Part A, a Medicare Plan F will pay for both the Part A deductible, which is $1,260, and the Part B deductible, which as of 2015 is $147, and it will pick up the 20% for both Parts A and B. So essentially, for the most part, don't be surprised if your hospital visit is covered between Part A, Part B, and Plan F at 100%. Okay? That's the way that works. One final word about Medicare Part B that I haven't mentioned, and that is the cost. It's not completely straightforward. If you go to www.medicare.gov and go to the Medicare website, it's not too bad. There's a little bar across the top, and you hit your Medicare costs, then you see Part B costs. Medicare Part B is a premium, is what's called means tested. It depends on how much you make. And there's different, for 2015, for example, your monthly premium, your monthly cost for Medicare Part B is, if you're an individual, if you earn $85,000 or less, it's $104.90. If you file for an individual, if you file jointly, your joint income needs to be $170,000 or less. So it gets more the more you make. The most they'll charge you if you're above as an individual $214,000 of income, or jointly $428,000 of income, they're going to charge you $335.70 for the exact same coverage. Okay, so that's what you need to know about the cost. Now, if you turn 65 and you're going to get income from Medicare, a Social Security check, you can deduct that premium from that check. Most people do that. But if you're going to turn 65 and you don't have income, then somehow or another you got to pay Medicare. They'll bill you quarterly, okay? And so it'll be whatever I just told you times 3. That'll be your quarterly billed amount for Medicare until such a time that you qualify for an income, and then you can switch over and have it deducted. Okay? Thanks. That'll be the end.